This research case study is looking at teaching tacting. Tacting with the typical "what is this" question can become rather mundane. So, looking at other options for prompting tax can be beneficial for clients. Um, the research question is: how do the use of sentence stems prompt impact uh, the acquisition of novel tax? So, the participant in this case study is a 4-year-old boy with a comorbid diagnosis of ASD and ADHD with hyperactivity. So, the participant is currently considered non vocal for communication purposes. He also has no training in any type of assistive technology or communication for communication purposes. So PECs or AAC devices, none of those are relevant to him and included in his programming at this time. The client does present with low baseline scores on intake assessments regarding landing and tacting. So those basic functional communication skills. The VB map was the assessment that was used to score this client at intake. He has recently mastered his manding goal from his program, and he is able to communicate in the form of requests um, in limited items. So, but he is currently unable to tact any novel items. It has also been determined that the client exhibits many behaviors that may indicate the ability um, to do some skills, but has been seen to be paired with high levels of non-compliant behavior. So these behaviors appear in the form of spontaneous responses to previous requests to comply. Building functional communication and growing the client's vocabulary is essential to the functional communication piece of growth. The previous research that we've looked at suggests that tact acquisition is not actually tied to specific prompts, and using question prompts may even impede learning. This is according to Marquise et al. In 2012. And additional research shows that changing prompt procedures to include things like echo prompt and incorporating autoclitic responses has also been successful. So the method portion, the design that was used was a BAB design used to test whether or not the specific prompt would produce more correct um, tact responses. Um, the current procedure that was in place that we used for baseline was the "what is this" question. This design, we were looking at what the current procedure was. Again, the "what is this" question versus a sentence stem prompt. So that dependent variable were those correct tact responses. The independent variable are those prompts. So the "what is this" current prompt, excuse me, that we use for baseline and in the baseline or current phases, and the sentence stem prompt that we use for the intervention phase. Data collection was taken on an iPad scoring sheet. Correct responses were indicated by a plus, and a non response or an incorrect response were marked with a minus on the data sheet. So the therapist used 6 specific items in tacting probes. So 3 items were specific to the current procedure phase, and a separate 3 items were used in the intervention phase. So there was no overlap between acquisition within phases. And baseline, it was collected over a 1 week period of time. Again, this is what is current practice. But the data was taken over a 1 week period of time, split between 2 days of the week and 3 different probes per day. So this resulted in a probe approximately every 2 hours for a possible of 6 correct tax per day. So, just to give a little bit of context, the participant was participating in a summer program at the clinical level and was in the therapeutic environment for 6 hours a day. So that's how we were able to get this level of probing. Again, this was in the clinical setting. Prior to these probes, the client was modeled at least 5 different items in order to model the correct behavior using the current strategy of asking the question, "What is this?" The item was then presented to the client with a verbal prompt. And if the client does not answer or answers inappropriately after 5 seconds, the therapist says the correct word and prompts the client to echo. But if that client were to answer the question prompt correctly, the client was presented with that item to engage with for a period of no longer than 30 seconds, depending on their interest at that time. After the question probe portion was done, the client was able to return to desired items and previous engagement in therapy. So these are essentially simply that probes. In baseline phases, we used three items. We used a bus toy, a Paw Patrol Marshall item, and a toy car, and these were presented with the question prompt. During intervention procedures, we used the same schedule of sessions, but we alternated over a 4 week period of time, and the graph will show that. The client was prompted with a phrase in this intervention phase to complete a sentence with I'm sorry, with a phrase to complete instead of a question. So this looked like it is a and with the item present. And the client again was in a play setting. These things were modeled at least 5 different times, similar to baseline procedures. But the therapist would start the prompt. It is a and would respond with the ball, the zebra, the book, whatever novel item we were using at that time. So if the client did not immediately complete the prompt, the therapist would imitate playing with the item to pique the client's interest. And if the client did not complete the prompt within 5 seconds, after trying to engage their interest, the therapist would complete the phrase by saying, "It's a," and then filling in the word for that item, and then moving on. So not a lot of attention was paid, whether or not they did or didn't in these phases. If the client finished correctly, the item would be presented, and praise will be delivered similar to baseline. The intervention phase, this intervention phase use a ball, a zebra, and a book. So both phases totaled 6 weeks, and there was 3 weeks for each intervention, but broken up into different times for each. So results during baseline, the client showed two correct responses out of six. So subsequent probes during current procedure phases showed lower rates of tacting behavior across all sessions. During intervention phases, higher rates of correct response. There were higher rates of correct responses. So the first day resulted in similar numbers, but the trend quickly increased. So the intervention phase two um, showed a decrease of appropriate responding behavior. However, it should be noted that there were some confounding variables going on in the clinic at that specific day of probing. And according to the graph results that you can see, um, we did it over a 6 week period of time. This was done first week was a current intervention. Then we did 2 weeks of intervent or yes, 2 weeks of intervention data. We did on the third week, excuse me, apologize. The on the sorry, in phase one of the intervention, you can see the multiple probes. We did 12 total probes. And the data shows that there is a functional relation. There appears to be a functional relation between the intervention and the rate of correct responses. So tacting skill acquisition was reached for the items that were probed during intervention procedures. So you can see those two responses on the current probe. We jump up to 4 and then we stay at 4. There was a slight decrease in probe 10. Again, that had to do with some of those confounding variables on that specific day. So for this specific client, this intervention did show to be successful. The client's background of non-compliant behavior, or what we um, hypothesized as non-compliant behavior, could be assumed to play a role in his willingness to finish sentence stems as opposed to answer questions on command. So the factor of control seems likely in this case, giving the control back to him in order to finish the prompt as opposed to requesting an answer to a prompt. Time constraints really restricted this research. With additional time, the probes would have continued for another 6 weeks, but the novel items would have been reversed in the interventions, and this would have allowed for more intentional time to look at whether or not the intervention was specific to skill acquisition or with this client, or if the items were just more or less desirable. Thank you.